Hi everyone, welcome to BEEqual's National Inclusion Week event. Today we're going to be talking about disability in the workplace. So without further ado, just to quickly run through the agenda, we're going to be having techUK talking about the Accessible Technology Group and giving you some tips and tricks and how to get involved in the work that we're doing. We've got Daniel from Neurodiversity Work discussing workplace needs assessments and access to work with all you need to know. And we also have Charlene from Purple talking about disability, a social and commercial opportunity for business. Just so everyone knows, we will be running a Q&A, but we'll do that at the end of the 3 talks just to allow everyone time. If you do have any questions, please fire them over via the chat box, or if you're feeling confident, raise your hand. And yeah, I can bring you on screen. So I'm just going to give Patrick the controls. Patrick.
Sorry, yep, just unmute there, sorry. Have we lost Nimi? Are there Nimi? Okay, I'll kick off. So, hi everyone. My name's Patrick Stevenson. I'm very proud to be the disability champion for the tech sector within the government's disability group, one of the 14 sector champions. Also, my day job is Director of Innovation and Healthcare at Fujitsu. So we're going to talk to you about a really good concept called Accessible Technology Essentials. And we're going to talk through what the challenges this concept's looking to address, working with techUK, the accessibility group, and talk through what type of organisations, the type of benefits that you'd get from this type of scheme. So if I move through to the next screen, and Harriet, could you move to the next screen, please? So the Assistive Technology Challenge, especially with disability in the workplace, we've come up with 5 key challenges that this concept's looking to address. And as I've sort of in my role as the sector champion for disability, talking to people all across the country, large organisations, people with lived disability experience, entrepreneurs, we're finding that 90% of assistive technology capability in modern products and services, your iPhone, your applications that you use day to day, are actually sitting within the technology products, but typically they're poorly communicated, those features within that product. Also, navigating assistive technology best practice. There's lots of legislation, there's lots of best practice out there, some brilliant work from lots of different groups, but it can be quite complicated and quite overlapping. So really, there's a need to simplify the accessibility information and signposting. Thirdly, there are a growing number of disabled AT entrepreneurs out there, and again, I speak to people on a weekly basis, just saying, right, we've got these brilliant solutions. We may have co-created them with multiple groups or across universities, but we have a real big problem connecting our products and services with consumers and sometimes medium and large tech organisations. Also, something I'm very passionate about too is AT capabilities are often bolted onto tech products and services at the end of the development cycle. So really inclusive by design, can be quite hit and miss depending on the type of organization that is developing products and services. So really that needs to stop. And again, we're looking at how we address this with the concept. And finally, accessibility of digital content is also very inconsistent. There's obviously new legislation or new policy within government for all government websites starting from September, need to obviously adhere to the PS bar sort of standards. But then going into the commercial sector and some smaller public bodies, really do struggle, even with the basics of getting their content accessible within documents and within digital services. We can move on to the next slide. So, big question. What if there was an assistive technology essentials scheme? So, within the techUK Accessible Technology Group, as a group, we've come up with this concept, ATE, and it's mirrored along the lines of the Cyber Essentials scheme. And hopefully, most of you are aware of Cyber Essentials, which is a common standard for all organisations, public or working in the public or the private sector, to meet a certain level of cybersecurity capability. There is also a Cyber Essentials Plus scheme for more demanding security contracts within government, where there's a deeper assessment type process. So as a group, a working group within techUK, we've started to explore assistive technology essentials. And really, like Cyber Essentials, we're just trying to find a common way of creating a bar where all organisations, small, medium or large, can address the 80% of accessible technology requirements to make sure that we give everyone in this country a fair chance when accessing digital services. And the type of things that it covers as a concept, legal standards, mentioned PS Bar, the Equality Act, public sector equality duty, and other standards. Also, compliant content creation. One of our members in the team is looking at a process called FAIR, which is, again, to simplify content. And then we're also looking at the people and process, and very importantly, the market engagement. And the concept is that products that people create, whether it's a piece of software or a piece of hardware, will be able to have an AT Essentials badge, yet again confirming that the organisation has been inclusive by design and that their product or their service is open for inclusive access. And then finally, we're looking at a certification scheme and a computer-based training type test, and also benchmarking and checklists for products and services. So again, what we're trying not to do here is reinvent the wheel. There's some brilliant resources across lots of different groups and organizations, but really it is quite difficult to navigate this. So really the idea is, let's address 80% of accessibility requirements within a very simple scheme called AT Essentials. We can move on to the next slide. So this is the last but one slide, just really saying, why would an organization get AT Essentials certified? Well, the first key area is that it enables organizations to take some simple steps to improve their AT capabilities. Also, with the badge, it'll improve credibility and reputation. And like Cyber Essentials, a number of smaller organizations I've spoken to, getting Cyber Essentials means that they can insert themselves into larger supply chains or bid directly for public procurement contracts. Also, Cyber Essentials will allow organizations to keep up to date with changes to legislation and policy as they happen. And something I'm quite passionate about is the purple pound. So too many times I hear organizations say, well, is your product or service inclusive by design? Well, I'm not planning anyone with a disability to use my product. It's like, oh, okay, well, I thought those days had gone, but you do realize, one, that's possibly not too legal. Two, it's not right. And three, you're missing out on the purple pound. You're missing out on a fifth of potential consumers of your products and services, and you're just completely ignoring that market. So again, just opening up access to the purple pound. So just on the last slide now, just really give you a bit of an update on the next steps of what we're doing with this concept. So we've presented this concept as a group to the Disability Minister within the UK, Justin Tomlinson, and to the Disability Unit within the Cabinet Office, which was the concept was very warmly received. So techUK as a group, we're going to continue now to build flesh on the bones of this concept and look to create some online content. And then people within the group, we've got 15 organisations in the group, including Harriet and eSynergy and other organisations. So very proud to be working with a brilliant team of people. We're going to then look to accredit the group and go through the assessment process to test it out. And then the third thing, really, please, everyone on this call, please get involved. So we're going to be working across multiple organisations, reaching out from techUK to other groups across the UK and organisations. And we're going to be working very closely with the Cabinet Office Disability Unit to co-create this concept further. And with a good wind, a prevailing wind, we're really looking to mobilise this concept in the next 6 to 12 months, and hopefully for it to be part of the National Disability Strategy, which is due to be published sometime spring next year. So that concludes my presentation. Really passionate and proud to be involved in this project with techUK. Thank you.
Thank you, Patrick. And yeah, just a shout out to Nimi there as well, who supports the group. If anyone would like to get involved, whether that's also committing as an organisation or giving up your time individually, Nimi, if you're comfortable, please send your contact details. I know we're always got on the chat box. I know we've always got a call for people who want to give up their time to support the cause, but equally, Nimi, I don't know if you've got some insight, but I know that we're always looking for speakers or organisations to support if they are working in the D&I space. But yeah, I'll hand over to Nimi quickly before we move on, just to give you a call for speakers and help.
Hi everyone. Yes, exactly what sort of Harriet and Patrick have already mentioned. So techUK is a tech trade association, for those of you that don't know, with over 850 members from the large global corporates of the world to smaller SMEs and startups and scale-ups. And we've created this accessible tech group to really highlight what work companies are doing in the space and to ensure that there's some coordination when it comes to assistive tech and beyond. So it's a small group, but we're really willing to learn, and we're constantly looking for kind of new information. So if you are interested in getting involved or just sending me some details, I will put my email address in the chat. Please do get in touch.
Thanks, Nimi. Thanks, Patrick. And the chat box has got some great questions already, and someone posting blogs and links. If you do have additional thoughts or questions, we'll take them at the end. But if you equally do want to share some resources from some of the talks that are going on, please do share. I'm sure the other attendees of the group will be interested in learning more. Oh, Patrick, you've missed something. And oh, he's unmuted. You're muted. He can't unmute himself. Who knew we all work in technology, eh?
That's okay. This slide was just an accessibility checklist for the slides before. So just a quick kind of look over as to what makes a difference when it comes to people who are visually impaired or hearing impaired users.
Amazing. Patrick's nodding furiously because he can't get himself off of mute. That's exactly what he wanted to say and tell you all. Yeah, and if you did want to use a similar checklist like this, we are recording the event, and we can share the recording. So all the information on the slides and information like this you can utilise in your own time. So without further ado, we've got Daniel Brooke here, who is a neurodiversity consultant at his own company of Neurodiversity Works. And how myself and Patrick came about talking about the topic of this event was very much on, yes, we know about diversity inclusion, yes, we know about disability, physical, neuro, mental health, but there are so many great outlets out there, grants, things that the government are doing that both individuals and organisations can take advantage of. And, you know, being a diversity manager and not being aware of all of these things, I thought it'd be great for others to learn and to Daniel to pass on his expertise. So Daniel, let me give you the remote control and mute myself.
Thanks, Harriet. Wonderful, thank you. I'm just going to test now if it'll move forward. I think I might need to get you to move the slides forward, if that's okay, Harriet. Thank you very much. Yeah, so first of all, it's great to be here today. And my name is Daniel Brooke. I'm the founder and director of a company called Neurodiversity Works Limited. And I'm a neurodiversity specialist and consultant. I have undertaken the Workplace Needs Assessor programme with the British Dyslexia Association, which makes me qualified to be able to do workplace needs assessments. Also experienced in delivering workplace coping strategies, coaching, which is probably one of the most impactful forms of support that you can give to individuals. Also, I've had the pleasure of supporting hundreds of neurodivergent people now in the workplace, and I'm really passionate about helping neurodivergent individuals and inclusive organisations develop. If we could go to the next slide, please, Harriet. Okay, so a little bit more about Neurodiversity Works. So we are London-based neurodiversity specialists, and we support neurodivergent people in the workplace through workplace needs assessments and workplace coaching. And we also do assistive technology training as well. And we help organisations to understand the benefits of neurodiversity through consultancy and awareness training, for example. If we could move to the next slide, Harriet. Thank you. So what is workplace needs assessment? And I'm going to be talking now about workplace needs assessments for individuals who are neurodivergent and have a neurodivergent condition such as dyslexia, dyspraxia, dyscalculia. So the workplace needs assessment must be conducted by a suitably qualified and experienced assessor. That's really, really important. So in terms of credentials, what you're going to be looking for is that somebody has done the workplace needs assessor program with the BDA or a similar organisation. And the assessment is actually split into two main parts: the assessment itself, and is followed up with a report. The purpose of the assessment is to identify what reasonable adjustments or additional support does the individual need in order to work well. And those reasonable adjustments can include things such as workplace coaching, assistive technology and training on those tools, adapted equipment, also things such as additional monitors, for example, and also awareness training for colleagues, so that colleagues are able to build up a better understanding, able to empathize more. The other great thing about having awareness training within your organizations is that individuals who may not realize that they're neurodivergent, after attending awareness training, very often want to explore whether they are, and obviously if they are, can then access support. Organisations have an obligation under the Equality Act 2010 to provide reasonable adjustments. So it's really important that organisations are aware of this. And as part of the workplace needs assessment process, it's really important to engage with the line manager, get their input, explain why recommendations are being made and how they can support the individual in putting those into place. If we could move to the next slide, please, Harriet. So in terms of the actual format of a workplace needs assessment, it would usually be conducted after the individual has had a screening or a diagnostic assessment. Individuals who are studying and wish to receive study support, they will need to have a diagnostic assessment to receive that support. But those in the workplace, if they feel that they may be neurodivergent and they've been through a screening process that gives an indication that they are, or that they have similar processing differences, then they can go straight to having a workplace needs assessment, and that would be the most appropriate route for them. It's going to be a semi-informal meeting that could last up to 2 hours. Sounds like a long time, but actually you do need that time in order to really get a full understanding of the challenges that the individual might face. It can be conducted face-to-face or online. So since the pandemic, I've been doing lots of workplace needs assessments online, and they do work really well. A slight adaptation that I've had to make is that normally I would go to the individual's workplace and see where they work and see where their desk is located. But now, as a workaround to that, I might ask for photos to be sent to me so that I can see their current work environment, which for most people is working from home at the moment. During the assessment, it's really important to consider the emotional impact that just being there and having an assessment can have on the individual. It might be the first time that they've actually had any support for their neurodivergent challenges, and that can be quite emotional for people. And as I was mentioning before, a separate meeting or a call with the line manager is highly recommended. If we could move to the next slide, please, Harriet. Okay, so the workplace needs assessment report itself, that's actually going to contain a bit of background information and context. So why is the individual here? Why are they now having a workplace needs assessment? What support have they received in the past? It's going to have a summary of their challenges and how those challenges are impacting them on their work. An example of a challenge could be that the individual finds reading large blocks of text quite difficult and finds understanding what actions they need to take after reading those documents could be. But also it includes the strengths, and it's really important that we include the strengths in the report, because lots of neurodivergent individuals have amazing sets of strengths, and it's really important to get them to talk about those, remind them that they have those, and for balance, it's important to include those in the report. The report will also outline suitable recommendations of support and reasonable adjustments, as I mentioned earlier, and justification as to why those recommendations have been made, so that when the line manager is reading the report, you know, they have a full understanding of why that particular piece of equipment or why that particular type of support is being recommended. It will also include the suppliers and costs of the equipment or coach providers, for example. And it should also include specific advice and recommendations for the employer and organisation. So that can include things like recommendations to arrange awareness training. It could be information for line managers in terms of things to be aware of when they're communicating. So a very, very simple example, lots of dyslexic individuals may prefer, when they're receiving written instructions, to have them bullet pointed or highlighted in the email if there's a lot of background and context also included in that email, just to make it easier for them to see. If we could move to the next slide, please, Harriet. So why should organisations offer these workplace needs assessments? Well, one of the important reasons is that they have obligations under the Equality Act 2010 to provide reasonable adjustments for people who are disabled. And in this context, individuals who are neurodivergent are considered as being disabled because they have a impairment of sorts that impacts them on a day-to-day basis. The other reasons are at least 15% of the population are neurodivergent, so that's quite a big percentage of your workforce. A HR consultancy called Willis, Towers and Watson, they did a bit of research and they found that 1 in 3 people actually said that their employer failed to offer additional support. The next bullet point there, neurodiversity is not on the agenda for 9 out of 10 UK organisations. So that quite staggering figure came out of a report that the CIPD produced in 2018. Also, neurodiverse teams are on average 50% more productive. So if you arrange appropriate support for individuals, which includes a workplace needs assessment, you're likely as an organisation to really see the benefits of providing that support. So organisations, companies like Microsoft, Hewlett-Packard Enterprise, Ford, EY, they've all reported large productivity gains since attracting more neurodiverse talent. And it costs a lot less than you think to actually provide the reasonable adjustments. Harriet, if you could move on to the next slide for me, please. Thank you. Oh, we fast forwarded there. Back one more, please. Lovely, thanks, Harriet. So what is access to work? So I was talking there about how some reasonable adjustments don't really cost that much for employers, but access to work is a government grant scheme which supports disabled people in work. And access to work will actually pay for assessments to see what individuals need at work to work well. And they're currently giving individuals extra support if they're now needing to work from home due to COVID. So lots of neurodivergent people are now working from home. Some are finding that that's a better environment for them to work from because there's less distractions, for example, but some are actually finding that now they are experiencing more challenges. They don't have access to the same support that they did in the office. Their children might be home with them. There's more distractions, there's more noise. So it's really important that we now provide them with support. They may not have a good office setup, for example. They might need additional monitors. If they've got short-term memory challenges, it's easier to have two. So things like that can be recommended. Individuals must apply for an access to work grant themselves, but I think really importantly, they might need help from their employer. So they might need information about sort of how the finances work and purchase orders and things like that. And the grant that's received will fund the reasonable adjustments that I mentioned before: workplace coaching, assistive technology and training, adapted equipment. And this isn't commonly known, but it will actually fund awareness training for colleagues as well. If we could jump to the next slide, please, Harriet. So in terms of the levels of funding given by Access to Work, so they will actually pay 100% of the costs of all the reasonable adjustments and recommendations of support if the individual has been in their job less than 6 weeks. After that period, the amount of funding depends on the number of employees that the organisation has. I won't read through those because you can see them on the slide there, but I'm going to jump to the very bottom point, which is actually the average cost of adjustments for a person with dyslexia is around £727. And if you compare that with the average cost of replacing an employee, that's going to be roughly around 50% of their annual salary. So it's really important that organisations help individuals that are experiencing challenges and point them towards a very clear process of support, which includes a workplace needs assessment. If we could move to the next slide, Harriet. And yeah, thank you very much, everyone. I've put my sort of LinkedIn and web details there if anyone wants to contact me after this.
Thank you so much, Daniel. That's so insightful, and sorry for my rubbish keyboard transition.
No problem at all.
Yeah, just to do a massive shout out to Daniel's organisation. You know, as he mentioned, 9 out of 10 companies don't have it on their agenda, and there's just absolutely no excuse in terms of lack of funding or available resources. And if you did need to continue that conversation further, I know that Daniel's got his details here. It might also be worth, Daniel, you posting them on the chat box so that if people can just click the link and make it easier for them. And I'm sure Daniel would be open to taking any questions at the end as well. So, Charlene, I will try and give you the controls. Yes, we've got Charlene here from Purple talking about the social and commercial benefit of disability. And just a point here to add when speaking to Charlene is quite often mental health isn't considered, well, it's not considered, it's not viewed as having a disability. We normally talk about physical or neurodivergent mental health, and Purple do support organisations both with well, not both, but physical, neuro and mental health as a disability in the workplace. So without further ado, Charlene, I'll hand over to you. You should now have control of the screen.
Fabulous. Thanks, Harriet. Good afternoon, everyone. As Harriet says, I'm Charlene and I lead the disability activities at Purple. Purple is a leading disability organisation that is supporting businesses on their disability journey so that they can better engage and support disabled people as employees as well as customers. So offering different types of training, consultancy and access auditing support to organisations. But today I'm going to talk about disability as a social and commercial benefit to your organisation, and I'll touch at the end as well on how COVID-19 has had an impact on employee mental health at this time, and to look at how we can support our peers during this period. Right, let's see if this works, Harriet. I might have to do the same as the rest. Oh, did I do that, Harriet? If you can just move on. Yeah, if you can move on to the next slide, I think that's probably best.
No worries.
Okay, thanks. So I know we've touched on obviously the disability already, but I just thought it would be good just to reflect again on the definition of disability, because it really does cover a wide range of conditions and impairments. But the legal definition under the Equality Act 2010, it's a physical or mental impairment that has a substantial and long-term negative effect on your ability to do normal daily activities. And the two words that really have to be highlighted, it's about it's being substantial and it's long-term. So it's about having that impact on your day-to-day life over the period thing. So next slide, Harriet. So why should disability matter to businesses? And I'm going to talk you through a range of different statistics that are out there, because the business case is quite compelling. So we know, so research has now shown, a recent report by Accenture found that companies that are embracing best practices for employing and supporting disabled people in their workforces have outperformed their peers over the last 4 years. And according to the Ethisphere Institute, the world's most ethical companies have outperformed the large cap index over 5 years by over 14%. So disability inclusive organisations do reap the rewards of more empowered employees, and they have improved retention rates, they have an enhanced reputation, and at the end of the day, they've also got improved financial performance. And as highlighted by both Daniel and Patrick, it's the law. Businesses have to take disability into account, because disabled people are protected under the Equality Act. So it is illegal to discriminate against people with disabilities. So businesses really do need to take into account their accessibility and inclusive practices. So updated statistics, 22% of people in the UK have a disability. So we're nearly at 1 in 4 now. And that's 14.1 million people in the UK have a disability. So really, we're not talking about a small minority anymore. And there's 19% of working age adults who have a disability. So technically 1 in 5 of your employees will have a disability or impairment. And we also know that the numbers of disabled people is rising year on year. So since 2017, it has grew from 11.9 million to 14.1 million in 2019. So it really is, the prevalence of disability is rising with age. Of those disabled people, 80% of them have a hidden impairment. So you wouldn't know to look at them that they have a disability. And so organisations are having to become more aware of hidden disabilities and how to engage and support those individuals who have those hidden disabilities. Also, 50% of us have someone in our family or in our close network that has a disability. So we wouldn't want our family member or someone in our network to have a lesser experience because of their disability, either as an employee or as a customer. So, when businesses take that into consideration, the fact is that disabled people are part of everybody's family. They're with us all the time. There's a 32% a gap in employment rates between disabled and non-disabled people, and I would probably think because of COVID that has probably increased even more. So we have about 1 million people with disabilities that are unemployed and who are looking for work. And research has actually shown that disabled people have a higher loyalty than disabled than their peers, have equivalent productivity to their peers, and actually lower absence records. So the business case for employing disabled talent is clear to see. But we also know that 45% of hiring managers, they remain nervous about employing somebody with a disability, and generally that's down to a lack of disability confidence. One of the biggest, I suppose, drivers for businesses to open their eyes to disability is the fact that disabled people and their families have a disposable spending power, the purple pound, as Patrick mentioned earlier, of 274 billion in the UK alone. So that has grown exponentially since the last update, which was in 2017, I think, which was at 249 billion. So we're now at 274 billion of spending power, the purple pound. But we also know that only 10% of businesses have a plan in place to actually access that market. So in terms of an opportunity to be had, there's a huge amount of spending power that the businesses can access. And this goes back to a point as well, the 75% fact that highlighted by Patrick earlier. So there's 75% of disabled people have actually left an organisation or a website due to poor accessibility. So issues around accessibility. And what that is costing in terms of the click away pound at the minute is 17.1 billion. So there's a lot, there's a huge loss for organisations who have not taken accessibility of their digital space into account, that they are losing billions of pounds a year because of poor website accessibility. So the statistics that is there in terms of disability are overwhelming as to why businesses really need to take into account their own inclusive practices and their accessibility, so as to be able to connect and reconnect and engage with disabled people, both as in terms of their disabled talent, but also in terms of their customer base. Next slide, please. Oh, yeah. So in terms of mental health and the impact that COVID-19 has had on employee mental health, it has been quite significant, and Daniel highlighted a little bit about that earlier. So what do we mean by our mental health? So mental health includes our cognitive and emotional well-being, and it affects how we think, how we feel, and how we behave. And when then we come into poor mental health or mental health illness, whenever we have a period of time that causes distress, and it impacts how we are functioning on a day-to-day basis. So again, I'm going to highlight some statistics around mental health, which I think can be quite alarming, really. But again, really highlighting the prevalence of mental health within the UK. So approximately 1 in 4 in the UK will experience a mental health problem each year. And we also know that mental health is driving the primary drivers around disability statistics worldwide. So there is a real prevalence and an increase in things like depression and anxiety that is then transversely increasing the number of disabled people within the UK and across the world. 1 in 5 women report to have a mental health problem, and 1 in 8 men report to having a mental health problem. But actually, what is quite, conversely going against this, in that in the numbers of suicides, so we had 6,507 suicides in the UK in 2018, and that was an increase of 11.5% from 2017. But 3/4 of these suicides in the UK were by men, with the highest suicide rate among men aged 45 to 49. So really, you know, the fact that probably more women are reporting to having mental health, but actually the impacts are probably felt more within the male population. And in England, 1 in 6 people report experience a common mental health problem such as anxiety and depression in any given week. And as I said, because of COVID, these numbers will be rising. Next slide, please, Harriet. So what has been exacerbated by COVID pandemic? So there's 3 stressors that are being exacerbated, or emotional stressors. So people are feeling more anxious, or having feelings of fear, and that feeling of uncertainty has increased. Situational stresses have increased, you know, so many of us are worried about our financial situation. People have maybe lost their jobs or have been furloughed and feel that there's a risk to their jobs. There's been changes to working practices. We're doing more home working than we've ever done before, and that can sort of cause feelings of isolation. And actually, a lot of us have had a loss of our plans. You know, people were maybe scheduled to get married or go on nice holidays, and all of that ended up having to be cancelled or not turning out the way that you had originally planned. And so those again can have an impact on how you're feeling. And then there is the psychosocial stressors. So, you know, worrying about your loved ones, having maybe increased childcare responsibilities, as we, you know, our families are together a lot more, and that causes more stress than support. And there could be relationship difficulties as well because of that, having to spend 24/7 in that situation, whereas going into the workplace might have provided you with a break, respite from that. So we do know that in terms of research that there has been a rise in depression and anxiety across the UK since COVID. The self-reported levels of happiness have gone down, and we are also feeling a heightened feelings of panic and hopelessness. So all of these feelings and all of these stressors are really having quite a negative impact on our own mental health. Next slide, Harriet. So what feelings are we our employees feeling at the moment? So we've got employees that are returning to the workplace and coming back, I mean, maybe after being furloughed. We've got those who are still being, are still on furlough, and then we've got those who are working primarily from home at the moment. So what types of feelings are we feeling? So the people that are maybe returning from work are feelings of anger, because they might feel that maybe not everybody's returning to the workplace or having to be in a face-to-face situation like with more people. So there could be an element of anger. There's also maybe an element of feeling of guilt, about worried about spreading the coronavirus to people around you, or, leaving your family to go out to work whenever maybe they are stressed about you leaving. There's maybe heightened levels again of anxiety, worried about catching the coronavirus and maybe uncertainty of, what the working environment's going to be like. And then there's, again, the higher levels of stress, feeling overwhelmed and under pressure with the new ways of working, and especially, I suppose, for those who are in more customer facing roles. In terms of staff that are still being in furlough, there's a low level of self-esteem and a lack of feeling maybe of purpose at this time, because they're not, having the opportunity to do their jobs. There's a lack of structure, I suppose, with being at home, and that then impacts your motivation. There could be huge financial concerns that causing them, again, heightened levels of stress. But on the flip side, some people have reported it being a positive experience, giving them an opportunity to maybe undertake some activities that they wouldn't necessarily have had the chance to do if they were in work. And then people that are working from home primarily, so we've started to see people reporting feelings of isolation and those feelings of, having a difficulty to, to set boundaries, between their work and home life, and everything is sort of blurred in together. We've now got what the term which is called Zoom burnout. So, overly, having over access to meetings and seeing people. We've certainly seen that we're meeting more people over Zoom or similar online platforms, that causes us to have more meetings than we probably would have done if we were in the office. So we definitely have seen an increase in sort of that Zoom burnout. And then there's, feelings of, again, lack of motivation with being at home, and the stress of maybe having your family and everybody around you, again, causing that blurred lines between home and family life, and work. Next slide. So actually, you can flip to the next one too, Harriet. So what can we do to really support our peers at this time? We all have a response. I think you missed one. Go back one, Harriet. Sorry. Yep, thank you. So we all have a responsibility. There's still a huge stigma wrapped around mental health and mental health well-being and ill mental health. So we have a responsibility to sort of demystify and to make this a more acceptable area of topic. And we can do that by being more open about our own mental health and our own feelings in the workplace. And also by educating ourselves and being more aware of the signs of mental health, and to be able to I suppose identify and potentially see if somebody within your teams or a colleague is struggling at this time. So in terms of signs of mental ill health is maybe poor concentration at work, being easily distracted, maybe seeing that an individual is worrying more and they're finding it hard to make decisions. They could be quite tearful, or they're expressing that they're tired all the time, or maybe becoming a little bit less talkative in situations, or you might notice, obviously, maybe that they're drinking more, or they're maybe a little bit irritable and they've got a bit of a short temper. So those could be all signs that maybe something's just not okay. And in the workplace, I suppose there's two behavioural signs that we would suggest that you keep an eye on. Is if somebody is like having increased sickness, a lot of absences, that could be a sign that maybe something is not right. And this uncharacteristic behaviour, especially for those that are close to you. But our recommendation is, if you're in doubt, just ask, how are you feeling? It's okay to have that conversation if that person is, especially if you are a close colleague. But we also have to remember that we have to highlight that, from a management point of view, it's good to let those individuals be aware that they should approach and talk to their manager if they're having a problem. But also we have to recognise that managers could be affected at this time as well. Harriet, can you move on to the next slide? So as I said, it's really important that that employees, if they are struggling, or people within your team, that they do go and speak to their manager or senior person within the organisation, because your business will have most likely something in place that will be able to provide you with some ongoing support. A lot of organisations have mental health first aiders or have an EAP that provides access to counselling services and so on. But but it's important that that you're able to activate that access by notifying and letting your manager, your line manager or HR know that you're possibly struggling, so that you can get that. As an individual, we can also then obviously refer people to external services, to let people know what's available to them, even if they don't want to maybe let their employer know at this time. And just simply, it's okay, letting people know that it's okay not to be okay. And it's just having those open and conversations, and being happy to share your own feelings as well is really important. And if you are really quite concerned about an individual, then I would say as well, please, you can approach a manager and notify them. if somebody doesn't want support or doesn't want help, you can't really force them, but at least if they're more aware and the organization is more aware of potentially what's going on, then they can keep an eye on that, and then open up that dialogue between those individuals. Next slide. Also, we would say avoid hearsay. So, you know, it's like a bit of a gossiping in the workplace can actually maybe cause some people's anxieties to increase. We would recommend that only really go to where there's approved news around COVID and the pandemic, you know, the World Health Organization or the NHS website, because obviously press and the tabloids, that's their job to maybe to whip up you know, more of a drama around things. So we do need to just keep to the facts, because we don't want to increase people's anxiety just around sort of hearsay and gossip that is happening at the minute. And it's really just important to just check in with your team mates during, you know, your meetings and during breaks, and again just highlighting that conversation so that everybody is aware that it's okay to have those open conversations as part of the team around how you're feeling at this time. Next slide. Okay, so quickly before, just as I draw this to the end, there's some really good well-being tips. There's 5 tips that are recommended to be able to help minimize stress and anxiety in the long term. So connecting with others. It's really this is useful in that, you know, it gives us a sense of belonging, and also gives us an opportunity to share our experiences and to, you know, to have those conversations, and it also gives us an opportunity to reach out and receive emotional support. So, you know, but making sure that you know that you do connect with others daily and all the time, and don't take yourself away from and isolate yourself. You know, it's really important that you do connect with family and friends and colleagues regularly. Being active. We all know that if you are more active, that actually improves your self-esteem, and actually exercise and the chemicals that get released during exercise alters our chemicals in our brain, and this has a really positive impact on our mood. So again, really important that you remain active to maintain your own mental health and well-being. Learning new skills. So we know that by taking on a new project or learning something new, it boosts your self-confidence and again builds that sense of purpose. And, you know, so we found that whenever the pandemic and lockdown began, there was a huge increase in number of people that were taking on new projects, to build their skills. These things like, you know, learning a new language or painting or drawing or gardening, again, just to, you know, build their skill set. So it's really good if you can, you know, undertake a new challenge, because it really does improve your self-confidence and self-esteem as well. We also know that by giving to others really gives us that sort of that fuzzy feeling, that, you know, sense of reward and, you know, really nice positive feelings, you know, so when we're given to others. So again, it's important that that you look at maybe ways that you can give and give back, you know, whether that is volunteering your time or even giving a donation into a charity shop. So it's, again, just have a think. It doesn't have to be a huge gesture, but just small little things can make you feel nice, and as I say, that fuzzy warm feeling inside, which will make you feel a lot better about yourself. And finally, it's really important to look at being more present. So evidence does suggest that by paying more attention to the present moment, so they call this mindfulness, can improve your mental health. So mindfulness is about sort of reconnecting with the world around us, being more present, and not living in our heads so much, you know, being, you know, understanding that you can, you know, not to be worried about the things you can't control, being very, what can you control, what is in the here and what is in the now, and not worrying about too much about what's potentially in the future. It's you know, that may cause increased anxiety. And there's lots of apps online, so there's Headspace and Calm that you can use to help improve your own sort of mindfulness activities, breathing exercises and so on. Next slide, Harriet. So Purple, since the pandemic, so we've been doing a lot of work with organisations in this space. We've run webinars for staff, and we've actually run webinars where staff are able to include their family around mental health and you know, mental health awareness and well-being and so on. We've provided training and webinars for line managers so that they can better recognise and be more mentally health aware and be more aware of the support that they can provide as a line manager. We've provided advice and guidance to HR, looking at what provision are they putting into place to support employee mental health at this time, and we've also done different types of well-being workshops on, like, you know, good sleep and good diet tips and techniques. What I'll do is I'll also put in the chat function, Harriet, my email address, so that anybody does want to talk to me about how Purple would be able to support organisations at this time around mental health, or indeed the wider disability inclusion topic, then I'd be happy to pick up those conversations. But thank you for listening, everyone.
Amazing, thank you so much, Charlie. Just so everyone knows, Patrick's had to drop off, but Nimi can take any questions relating to the techUK accessibility group. So I'm just going to, they've got so many questions over the chat box. How this is going to work is I'm just going to read them out, but if anyone would like to come and speak to the panelists directly, do just raise your hand and I can give you the option to speak. So there was a question here, is there a listing of all the technology out there, reviews, what they for, etc., and could disabled employees try the technology before the employer purchases the technology? That was aimed at Patrick, and he actually put a message in the chat, but just for the sake of everyone, I'm going to read it out. So he uses a tool called ability.net. So that's www.abilitynet.org.uk, a great resource for AT technology. And yes, this should always be the case, but this depends on each organisation and their capability to support assistive technology. So I think summary of that is to do your research and make sure you're asking your organisation the capability and capacity that they have. So on to the next question. Question for Daniel, please. Is it okay for neurodivergent staff to lead awareness training with the permission of HR and directorship? In my experience, this empowers the staff member and makes it more personal and less abstract. Daniel, if you wouldn't mind answering that.
Yeah, sure. I mean, yes, having somebody who's got lived experience delivering the awareness training and talking about that is fantastic. I think the only thing that you might need to be sort of aware of with that is that individuals' own lived experience, you know, every dyslexic person's going to be different. Everyone's going to need something different. So as long as you're kind of when you're delivering that, you're kind of being aware that, you know, dyslexia or other neurodivergent conditions can affect people very, very differently, and the support they need is likely to be very different, and a real person-centered approach is needed, then yes, absolutely, you know, go ahead and do that and spread the word, really. But, you know, you might want to think about bringing somebody in who's you know, a specialist if you're really thinking about influencing and changing what happens in your organization.
Thanks, Daniel. And I think this will be worth having the opinions of Daniel and Charlene. Someone's put here, long term, that admits the possibility of short-term disabilities. What is the reason for this? Charlene, I don't know if you want to give your insight. I know that when you were talking through your presentation, you were talking about the definition. So yeah, it'd be great to have your opinion on this.
Yeah, the fact is that, you know, there in terms of the Equality Act and being protected, you know, you can have a short-term disability. So, for example, you could have broken your leg and caused you, you know, to have accessibility and mobility issues. But that's only over a short period of time. But in terms of, like, to be protected under the Equality Act, this has to be a long-term condition that in fact affects your day-to-day living. So it's just in terms of the Equality Act and how you're protected by law. that refers to.
And what would you, just some insight, if someone did have a short-term condition, how could they engage with their organisation? You know, they may need reasonable adjustments, and I understand that legally it's not protected under the Equality Act 2010, but just in terms of as an individual or maybe as a line manager in organisation, what would you recommend?
Well, for any organisation, best practices and good practices would be that you ensure that your employee has the tools to be able to do the job. And if they have an accessibility issue, even if it is for a short period of time, they should try to do their best to meet those access needs. So the advice would be you have to have those conversations with your line manager and with your organisation about your accessibility requirements, and to see if there is a reasonable adjustment that can be made. So for example, you know, and this is where the Equality Act comes in, if you have let's say a short-term condition, such as you've broken your leg or something, and you need to get access to a building. Now, a building may not, that if they have like an access issue, will not maybe necessarily put in a lift for you just because of that short-term requirement. But if this was a long-term issue, then the argument could be that actually then a reasonable adjustment is that you have to find a way to be able to let me into the office. So that's why it's about the long-term impact, because it wouldn't be reasonable. It couldn't be argued that it's reasonable for a business to change how they operate for a short period of time because the business case is not there under the law.
Thanks, Charlene. Daniel, do you have any additions from a neurodiversity perspective?
Yeah, just to add really that, you know, sometimes individuals who might have had like a head injury or might be taking certain types of medication can actually start experiencing challenges that are very similar to those of somebody who's got a neurodivergent condition such as dyslexia. And in those scenarios, what the employer should really be doing is providing them with support for that, and the best way to find out what the right support is to arrange a workplace needs assessment with somebody that has experience, because we're still able to provide the right recommendations even if the challenge is not going to be something that's going to be long term. It's about what is it that's going to help you work at your best now during that period where you're taking this medication, or during the period of rehabilitation after having a head injury, for example.
Thanks, Daniel. And another one for you. How can we afford adjustments when we are at home?
So if you're working from home but still employed by somebody, then an employer should still be providing you with reasonable adjustments, and paying for those. And we talked about how you can get support from Access to Work to help part fund that. If you are working from home, you're contracting, you're self-employed, you run your own business, for example, you can still get funding support from Access to Work, and you can still put in a application for that. So you're still able to access that support if you need it.
Thank you. And actually, you've kind of started to answer the next question, which is around contracting. Does it only support permanent employees? This person hasn't specified whether this is in relation to the workplace need assessment or the Equality Act and reasonable adjustments. So maybe we can cover both. So let me rephrase the question. If you are a contractor, can you apply for a workplace needs assessment? And as a contractor, are you eligible to be protected under the Equality Act and eligible for reasonable adjustments?
So from a neurodivergent perspective, if yes you are. You can contact a provider and get a workplace needs assessment done, and then put in a claim afterwards to Access to Work to get that assessment paid for, and get some of the adjustments part funded. depending on how many people are employed by, sorry, you'll only be, you're self-employed, so there's only be one person, so the amount of funding that you're going to get is quite large. Yeah, sorry, I hope that's answered the question.
Yeah, so this individual's just clarified what they meant was, how can they afford to pay for adjustments or the remaining 16 hours a day for non-working hours? Don't know if that makes more sense.
I'm sorry, I've got a bit stuck on this. That's my own neurodivergent challenges coming out there. But I think the Access to Work scheme is available whether you are employed or self-employed, and they will provide funding support regardless of what your employment status is. There's certain criteria and there's certain questions that they're going to ask you, but you can still access support and get funding towards that regardless of your employment status.
Perfect. Well, if that hasn't answered the question, please do fire another one over via the chat box, or reach out directly to myself or Daniel, who can answer your question in further. And then I think we've got a final one here around mental health. I know that mental health was brought up by yourself, Charlene. It's more of a general question around like mental health first aiders. Maybe you can just give everyone a little insight into how that works in an organisation, or maybe how they can become mentally health first aid trained.
Yeah, well, a lot of organisations. So it's a training course, obviously, that you pay to go on, and it really looks at how you are more mentally health aware yourself, so you understand sort of the signs of mental illness, and also giving you training in how to have those conversations, having those sensitive conversations with the individuals, and also then understanding and increasing your understanding of where to go for particular types of support, and how to escalate it. Obviously, it's not a training program where you then are medically qualified to give mental health advice and guidance, but it's about where you can support that individual to be able to refer them to it. So it is, and the reason why it's quite good, a lot of businesses now are looking at mental health first aid courses, is so that there is champions for mental health within those organisations. So contact your HR team or your learning and develop teams to see if that is something that that your organisation provides or would be willing to provide for you and to get paid for. But you can go on and you can find providers that provide the training, and you can pay for it yourself if you need to, or if you want to, as part of your own, I suppose, developments. But as I say, organisations are now embracing these training courses so that there is champions and those with higher level of understanding of mental health within their business.
Thanks, Charlene. And just to add, I'm a mental health first aid I'm mental health first aid trained at my organisation. Just be wary when you are looking for courses, and make sure that they're a Mental Health First Aid England accredited. And if you are struggling with courses, I went through the inclusion initiative, so yeah, I would recommend them for that part. And just to quickly go back as a final question, on the reasonable adjustment question, I've just gotten more clarification. So they meant paying for adjustments. Sorry, they meant paying for adjustments or the remaining 16 hours a day. So what happens if you can't afford reasonable adjustments that are anything to do with work? It's just for you as an individual. I suppose that's less of this conversation today is around workplace needs. I suppose that would be disability or employment disability benefit or anything like that. I don't know if any of Daniel or Charlene, you have an idea.
Yeah. Well, if
that is the question.
I think, you know, so if you do have a disability, you should be able to get access to funding, especially if it is around your living and being able to live a day-to-day life. So your local authorities will be able to provide you with information on that. So you do get funds. There is funds for those with disabilities to be able to support them in their day-to-day lives, or to provide for their care. So I would go there. I'd look at your local authorities for that funding.
Amazing. Well, thank you so much, everyone. Most people have had to drop off the call now. We've gone over our hour slot by quite a bit. I just wanted to say, if anyone is still on the call, we're always speakers or people to get involved for future BEEqual events. We actually have a BEEqual event running on the 13th of October for Ada Lovelace Day, talking about gender and LGBTQ+ in the workplace as an open dialogue. So all of those questions around which pronoun to use, where is gender now? It's not just male and female. You know, what can you do as an organisation? We're very lucky. We have a representative from Out and Tech on the call. We have the Department for Education, DfE Digital, and we also have trans girls. So do please be sure to sign up. And I think that's it. So thank you so much, everyone. I will send over the recording and slides. I know that that there was an occasion where the content wasn't necessarily read out, but not to worry, we'll be sending the slides and the recording, so you should be able to catch up. But I am sorry if that disadvantaged anyone. So thank you so much for joining, and have an amazing rest of National Inclusion Week. Thanks, everyone.
Bye.
Bye.
Bye.